Hello friends, welcome back to Complete Medical Coding. Today I am here with some important mock questions. Last week also I had taken few mock questions and this week few more, let's discuss few more mock questions, okay? And then I'm getting some, inquiries about like to do more and more ICD questions that also I will do in the upcoming sessions. Anyway, because this one I had already prepared before, so let's begin with more questions today. All right friends, so if you find this video useful, please share it among your friends, and if you are new to the channel, please subscribe me. Anyway, let's discuss the questions today. Moving directly to the questions. All right, first question. 64-year-old female who has multiple sclerosis fell from her walker and landed on a glass table. She lacerated her forehead, cheek and chin, and the total length of these lacerations was 6 cm. Her right arm and left leg had deep cuts measuring 5 cm on each extremity. Her right hand and right foot had a total of 3 cm lacerations. The emergency department physician repaired the lacerations as follows. The forehead, cheek and chin had debridement and cleaning of glass debris, with the lacerations being closed with 60 Prolene sutures. The arm and leg were repaired by 60 vicryl subcutaneous sutures and Prolene sutures on the skin. The hand and foot were closed with adhesive strips. Select the appropriate procedure codes for this visit. So here we have to code for the laceration. Okay, laceration as mentioned, the size and everything is being mentioned in the question. Okay, right arm and left leg had deep cuts measuring 5 cm on each extremity. So right arm is 5 cm, left leg is 5 cm. Okay, each it's mentioned. Anyway, let's check the CPT codes one by one. What's the first code? First option, first code 12014. 12014 is simple repair of, you can open your CPT code book, okay, 12014, go to 12014. Simple repair of superficial wounds of face, ears, eyelids, nose, lips, 5.1 cm to 7.5 cm. This is total of okay, right here what has happened, right hand and right foot had total of 3 cm lacerations. Okay, so cuts are mentioned. See, on the second sentence it's mentioned, she lacerated her forehead, cheek and chin. So forehead, cheek and chin, total of 6 cm laceration. Okay, right arm and left leg had deep cuts. Right hand and right foot had total of 3 cm. Okay, so what will be the total? I mean, how you will code the laceration, that is what in the question it is. So the first code 12014, that is simple repair of superficial wounds. Okay, here it is how you will know that it is simple or intermediate or complex repair. How you will know that when you get a question, how you will know that it is a simple or intermediate or complex repair. Yeah, so here it's mentioned almost at the end that the arm and legs were repaired by 60 vicryl subcutaneous sutures. So it means if you take simple layer, how is simple layer closure? Simple layer closure is only on the epidermis or dermis skin. Okay, simple layer closure or layer closure. We can say layer closure, another name for simple repair. But if you go to intermediate repair, it means a layered closure, means more than one layer of the skin is getting sutured or getting closed. So here it is mentioned as subcutaneous sutures. So it means the sutures is being the sutures is being done through the subcutaneous tissue. So it means this is a layered closure or intermediate repair, you can say. Complex means it will be extensive, deep. Okay. Anyway, this is not complex, so this is intermediate repair. So you have to code for the intermediate repair wound. So the first code is 12014, which is simple repair. So that is the wrong option, wrong code. Okay. Now, so skip that one. Now, if you go to option B, 12053. What is 12053? Intermediate repair, intermediate wounds of neck, hands, feet, or external genitalia, 5.1 centimeter to 7.5 centimeter. Yes. What is the first one? She lacerated her forehead, cheek, and chin. That is measuring up to 6 centimeter. So, this is between 5.1 and 7.5. Right? So, this code we need this code. Okay. If you go to second code, 12034. What is 12034 again? It is intermediate repair, intermediate wound of scalp, axillate, trunk, and extremities. Yeah, this is trunk and extremities. And what is the size of trunk and extremities here? Right and right arm and left leg had deep cuts measuring 5 centimeter. So there it is 5 centimeter for the right arm and left leg. Right arm and left leg had deep cuts measuring 5 centimeter. So it means 10. Then right hand and right foot had a total of 3 centimeter lacerations. But right hand is already mentioned before. So together total is 3 centimeters. So which will make up to, you can say 12 centimeter. It's coming to 13, but right hand is already included before, right? Right arm and left leg had deep cuts of 5 centimeter. Right hand and right foot had a total of 3 centimeter lacerations. So it will come up to, it will come in between like less than 13 centimeter, right? So if you go to second code 12034, which is repair of intermediate wounds for 7.6 centimeter to 12.5 centimeter. The size is measuring between 7.6 centimeter to 12.5 centimeter. Okay. Then, so that also we need, because in the question it is mentioned both the lacerations, like on the forehead, cheek and chin, and then forehead, cheek and chin, it's mentioned that should be coded first, and second it's mentioned on the extremities, upper and lower extremities. So that also needs to be coded. So it's marked with a modifier 51 because it's a multiple procedure, right? Now, if you go to third code 12002, in same option B 12002, what is that code? It's for simple repair of wounds of, again, scalp, neck, external genitalia, all this. There is no simple repair in the question. So that is wrong code. Okay. Now, so that is incorrect. So we already got the codes 12053 and 12034, which is in options B and D only. But in option B, there is additional 12002 simple repair is mentioned, which is wrong. So option D is the answer, 12053 and 12034 with modifier 51 for the multiple procedure. Okay. Hope you understood. It's little that, some questions little difficult to understand, but still, even I also got confused. I only made the question, prepared the question, but suddenly I also got confused. Anyway, I hope you understood. You can able to understand now. So this is how it is. Okay. So answer is option D, 12053. and 12034 with modifier 51. Alright. Now let's move to second question. The patient is a 78-year-old white female with morbid obesity that presented with small bowel obstruction. She had surgery approximately 1 week ago and underwent exploration which required a small bowel resection of the terminal ileum and anastomosis, leaving her with a large inferior ventral hernia. 2 days ago, she started having drainage from her wound, which has become more serious. She is now being taken back to the operating room, reopening the original incision with a scalpel. The intestine was examined and anastomosis was reopened, excised at both ends, and further excision of intestine. The fresh ends were created to perform another end-to-end anastomosis. What's the correct procedure code? So here also we have to find the correct procedure code. We have to find the procedure, the CPT code only. Okay. So what is the procedure carried out? And she had approximately surgery 1 week ago, underwent exploration. She required a small bowel resection of terminal ileum. Yeah, bowel resection of terminal ileum. Okay, if you have confusion in the question, you can do one thing. You can go directly to the options. We will go directly to options because it's a single code and it's easy for you to understand. Okay. So what is the first code? First option. First code 44120. What is 44120? 44120 is enterectomy, resection of small intestine, single resection and anastomosis. Yes, in the question it is resection of small intestine, anastomosis is mentioned. Yeah, small bowel resection of terminal ileum. So ileum which is coming under small intestine. So resection of small intestine, single resection and anastomosis, because only single resection here it means only in the ileum it's mentioned. So single, yeah, that is the code we need. You can just check the other options also. What is 44126? Second option 44126 is enterectomy, resection of small intestine for congenital atresia, single resection and anastomosis of proximal segment of intestine without tapering. No, proximal segment of intestine, nothing mentioned about tapering or whatever is mentioned. Now, option C again it is 44120. Only the modifiers are different. I'll come back to that. And what is 44202? In option D, 44202 is laparoscopy surgical enterectomy. No, this is not laparoscopy. Nothing mentioned about laparoscopy, so that's wrong. So we got the code as 44120. And which modifier you should use, 78 or 76? 78 modifier is unplanned return to the operating room, okay, by the same physician. That is the modifier 78. And if you check modifier 76, that is a repeat procedure. 78 is unplanned return to operating room by the same physician for some preoperative procedure. And modifier 76 is the repeat procedure by the same physician. Which is applicable here? Yes, it is 78, right? Because it's an unplanned procedure. Sorry, unplanned return to the operating room. Because in the question it is clearly mentioned. Second sentence, she had surgery approximately 1 week ago and underwent exploration. And then 2 days ago she started drainage from her wound. So she came back for the operation. So the correct modifier here is 78. So the answer here is option A, 44120. Enterectomy for the small section of small intestine and append it with a modifier 78 for the unplanned return to the operating room. Okay. Third question. MRI reveals patient has cervical stenosis. It was determined he should undergo bilateral cervical laminectomy at C3 through C6 and fusion. The edges of the laminectomy were then cleaned up with a kerosene and 4 aminotomies were done at C4, C5 and C6. The stenosis is central. A facetectomy is performed by using a bar. Nerve root canals were freed by additional resection of the facet, and compression of the spinal cord was relieved by removal of a tissue overgrowth around the foramen, which CPT code should be used for this procedure. Okay. So here, what is the patient having? The patient is having cervical stenosis. That is the diagnosis, cervical stenosis. Okay, and the patient had bilateral cervical laminectomy. The patient was having bilateral cervical laminectomy. And then the edges of the laminectomy were then cleaned up. All those stories have been mentioned. So anyway, let's find out the answer. Let's go to the codes one by one. Going to the first option, first code 63045. What is 63045? Laminectomy. We have to code for the bilateral. Bilateral word is mentioned. So remember to use the modifier 50. Okay. Cervical laminectomy. Yeah. So 63045 is laminectomy, facetectomy and foraminotomy, unilateral or bilateral, with decompression of spinal cord, cauda, equina and nerve root. Single vertebral segment, cervical. Yes, this is cervical laminectomy. Is this a single vertebral segment? C3 through C6 and fusion. Single. It's mentioned as from C3 to C6. So that is single, right? That you have to code. But here we won't append modifier 50 as mentioned in the first option, because in the description of this code itself it is mentioned that it can be a unilateral or a bilateral. So whether it won't whether if it is a unilateral or bilateral, we won't use modifier. So don't think that in the question it is bilateral, so putting modifier 50 as in option A, that is wrong, because in the description itself it is mentioned it can be for unilateral or bilateral. So don't append modifier 50. So option A is incorrect. Now if you go to option B, another code 63035. What is 63035? That is an add-on code. If you check the CPT code book, 63035 is laminotomy, but it's an add-on code. Add-on code will never come as the primary code, right? So that's also wrong. See, like this you can save time during examination. Okay, skipping all. 63015. What is option C? 63015 is again laminectomy with exploration and decompression of spinal cord without facetectomy, thoraectomy or discectomy. More than 2 vertebral segments, cervical. Here it is mentioned without facetectomy for foraminotomy. No, we have, it's mentioned clearly, the stenosis is in the question. Almost in the middle it is mentioned, the stenosis is central. Facetectomy is performed, right? Facetectomy is included. Foraminotomies were done. That is also mentioned in the question. So everything should be included, which is there only in one CPT code 63045. So I'll read out that code for you once again. 63045 is laminectomy, facetectomy and foraminotomy. Yes, we need all these three. Either unilateral or bilateral. Okay. With decompression of spinal cord, cauda, equina and nerve roots. Single vertebral segment, cervical. Yes, that code we need. And what is the second code in option D? 63048. Each additional segment. What is in our question? C3 through C6. That is the laminectomy in the cervical segment performed in the question. It is C3 through C6. So C3 through C6 means how many segments are present? C3, C4, C5, C6, right? 4 cervical segments are present. So you have to code for 4. So the first code 63045 is for a single segment, cervical single segment. If you go to the next code 63048 is each additional segment of cervical, thoracic or lumbar. List separately in addition to primary procedure. Yeah. So for each additional segment you have to use 63048. So we have here how many additional segments? C3 through C6. So that is 4. So 1 is already done in first code. So the remaining 3. That's how you got the answer. You will get the answer as option D. Okay, 63045 for the first cervical segment. 63048 for each additional cervical segments. 3 additional. Okay. On the third line, it's mentioned edges of laminectomy were then cleaned up with kerosene and foraminotomies were done at C4, C5, C6. So, don't think that C4, C5, C6, C3 only. No, that is for foraminotomy. Okay. But our laminectomy, cervical laminectomy is performed from C3 through C6. That's what we have to count. So, as I told you, answer is option D. Okay. Please mark me in comments if you have any doubts. Fourth question. Patient who is a borderline diabetic has been sent to the laboratory to have an oral glucose tolerance test. Glucose tolerance test, GTT. It's called as GTT. Okay, short form. Patient drank the glucose and 5 blood specimens were taken every 30 to 60 minutes up to 3 hours to determine how quickly the glucose is cleared from the blood. So that's a procedure. GTT is a test. I mean not procedure. It's a test to determine how fastly the glucose is cleared from the blood or how much the glucose is absorbing, whatever it is. Okay. So what codes should be reported for this test? Alright. So you have to find the code for GTT. It's a simple one. If you go to first option 82947, those who are working will be knowing. Those who are working in medical center or hospitals will be knowing this code, right? 82947, it's a code for fasting blood sugar. That is not the code for GTT. So it's wrong. 82947 is for fasting blood sugar. Okay. And what is 82946? 82946 is 82947 is glucose quantitative blood, yeah, fasting or random, whatever, but not through the strip, except reagent strip. 82946 is glucagon tolerance test. No, ours is glucose tolerance test. Both are different. This is glucagon. It's wrong. If you go to third option 80422. What is 80422? 80422. Let's go and take 80422 is again glucagon tolerance panel. That's also wrong. So option D 82951. What is 82951? Yes, glucose tolerance test GTT. Yeah. 3 specimens includes glucose. Yes, includes glucose means here it's mentioned that patient drank the glucose because it will be given from the provider, from the hospital. So 82951 is GTT, glucose tolerance test. Yes, that's what we need. And what is 82952? Again, glucose tolerance test. Each additional beyond 3 specimens. Yes, here 5 blood specimens is mentioned. So up to 3 specimens, up to 3 blood samples, the code is 82951 for the GTT. Okay. 3 specimens it's mentioned, right? 82951. So GTT 3 specimens including glucose, and each additional specimen beyond 3 specimens you have to code 82952. So here 5 additional, I mean total of 5 blood samples are there. Total of 5 blood specimens. So 3 will be gone for 82951 code, and the remaining 2 you have to mark the additional code, add-on code 82952 times 2. That's how you need to code. Okay, so answer here is option D. GTT First 3 specimen use code 82951 and the each additional specimen use 82952. Here total 5, so times 2. Okay. Fifth question. 24-year-old patient had an abscess by her vulva which burst. She has developed a soft tissue infection caused by gas gangrene. The area was debrided of necrotic infected tissue. All of the pus was removed and irrigation was performed with a liter of saline until clear and clean. The infected area was completely drained and the wound was packed gently with sterile saline moistened gauze and pads were placed on top of this. What is the correct CPT and ICD code? So anyway, in ICD in our option only one is there. Still, we will find out what is the procedure and what is the ICD code carried out here. Yeah. What is the first option? 56405. The first code 56405 is incision and drainage of vulva or perineal abscess. IND of vulva. The patient had an abscess and it burst, right, on the question. And then the area was debrided. Debridement is the procedure, not IND. So that is wrong. IND code is wrong. Now, second option 10061. What is 10061? 10061. Okay, 10061 is, I didn't get it. I'm still searching for that. Yeah. 10061. Again, incision and drainage is mentioned. This is not incision and drainage, okay? Incision and drainage of abscess, complicated or multiple? No. What is 19120? Option C. 19120. 19120, excision of cyst, fibroadenoma or other benign or malignant tumor, aberrant breast tissue, duct lesion, nipple or areolar lesion, open male or female, one or more lesions. 19120. So excision of cyst is mentioned here. Let's wait for the last one also. 11042. What is 11042? 42. Option D. Debridement subcutaneous tissue. So yes, in our question it is mentioned. It's clearly mentioned as debridement, right? All of the the area was debrided of necrotic infected tissue. So it's clearly mentioned that it's a debridement. So debridement code is only in option D. So the answer here is option D. Anyway, no ICD code is mentioned, so you don't have to find out. If in case if there is, if the ICD code is present, what will be the ICD here? Gas gangrene should be the ICD code because it's mentioned in the second sentence. She has developed a soft tissue infection caused by gas gangrene. So gas gangrene could be the ICD code. Anyway, it's not present, so just leave it. So debridement 11042 is the answer here. Answer is option D. Okay. So that's it, friends. That's it for today. I think few questions were little confusing, but it is, if you can read and understand the questions one by one, it will be easy for you. For any queries, enquiries, any doubts, clarifications, please mark me in the comments and I'll be get back to you soon as possible. So thank you so much, friends. Stay tuned for more videos. Those who are new, please subscribe. And thank you so much for all your support. Bye. Take care.